Hi, I wanted to talk today a little bit about dysphoric milk ejection reflex, or DMARE, as it is known for short. So dysphoric means negative emotions. It's the opposite of euphoric. And unfortunately, some mothers who breastfeed might have quite a negative emotions of maybe anxiety, stress, or really sometimes depression, even, and sometimes also a nausea as well. This is a phenomenon that is unfortunately outside of the mother's control because it's emotionally driven. So it's really physiological. So mom can't control those emotions. And usually it would present a few seconds before the milk ejection reflex or the letdown happens. And mom might have quite a strong feelings then. Usually it would settle within a few minutes after the milk ejection reflex happens and moms are able to carry on breastfeeding. Sometimes it can be quite severe, so mom really need to, in a sense, prepare for those. There unfortunately isn't too much that mom can do about it. Just really deal with the negative emotions. So trying to alleviate stress as much as possible. Perhaps practice mindfulness, because mindfulness will really then try to take their mind off what is happening there and then, together with some breathing exercises. Have a great way of helping mothers to alleviate those symptoms. Skin to skin is also very beneficial because when mom and babies are in a skin to skin, the oxytocin levels are higher and the cortisol levels go down. And because the DMARE is associated with the drop of dopamine in mom's bloodstream, the mood balancing hormone, really, the skin to skin will really hopefully help both. Also making sure that the baby is as well positioned and latched on a breast as possible, so there is no any possible pain during the feed as well. Trying to find the support is also very important, and there is some support on the Facebook or sort of groups that mom can access. And in a sense, just realizing that this is a phenomenon and it is valid for them to have these negative emotions that are associated with the breastfeeding, or sometimes even feeling nauseous when they are breastfeeding their baby. It's really quite a good validation. The DMARE usually starts a few seconds before the milk ejection reflex happens and then usually subsides a few minutes after, so it's really associated with the letdown or the milk ejection reflex. Sometimes it will subside after the first few weeks of breastfeeding, but unfortunately for some mums, this can carry on all the way through their breastfeeding journey until they really wean babies from the breast and stop breastfeeding. But just knowing that there possibly is support and their feelings are valid can really make a huge difference to those mums. In some severe cases, mum can possibly go on medication, in which case they would be advised to take an antidepressant that are going to raise the dopamine levels, the mood enhancing hormone levels. So if mums are really, really badly suffering with the dysphoric milk ejection reflex, there is a possibility of medication. Sometimes women can also suffer from breastfeeding aversion and agitation. And this is also another phenomenon, in which case mom can feel a sensation, for example, on their skin, as if their skin is crawling. They have a very negative feelings, quite anxiety, possibly depression, or really very negative feelings while they are breastfeeding. There is an amazing group, Breastfeeding Aversion, both on Facebook and on Instagram, which is led by Zainab Yates, who also written a book about this. So please, if you are suffering with one of those feelings, or if you are feeling that is possibly maybe you, just reach out to a breastfeeding specialist or just have a look for some support, because your feelings are valid, and I really hope that this will help you a little bit. In terms of sometimes lifestyle changes might really be beneficial. It's really important to drink plenty of liquid, just the normal amount, but sometimes moms in a sense forget to drink, and dehydration can have a negative effect as well. The other thing is also caffeine consumption. Sometimes really taking out the caffeine from mother's diet can really have a positive effect as well on this. And while I completely understand that motherhood can be quite stressful, but trying to alleviate the stress as much as possible, and maybe sort of, looking for some help, whatever little help it may be, can really, really help mothers, especially in the first parts of the motherhood, once they have their babies. So please reach out if there is anything else that we can help you with. All the best.